Well, as we are talking about a healthy lifestyle, let's talk about healthy trends or the trends for the past year and what do we expect afterwards about these health trends that we're seeing here in the Philippines. So we have in the studio a health activist and fitness enthusiast, Maria Fatima Jofty Villana, to talk about this year's top health trends and what to expect this coming 2014. So good morning, Jofty, and welcome to Solar Daybreak. Thank you so much for joining us.
Yes, good morning, Ameline. Good morning to all televiewers. Yeah, good morning.
Well, let's first look at the status of healthcare in our country. I understand that you've been looking into the DOH budget and how this has been used so far. Can you tell us more about this?
Yes, actually, I am with the Alternative Budget Initiative, or ABI Health Cluster, and we are monitoring the DOH budget. We are the partner organization or civil society organization of the Department of Health, and I am in the subcluster, meaning the preventive and integrative healthcare. So what we do is we monitor and we are consulted by the DOH with regards to their annual budget. And for this 2014, they've shared with us what the budget of the DOH will be. So mostly are really for infrastructure and health facilities.
Okay.
But for us, civil society organizations, we are into the preventive healthcare. Of course, prevention does not mean infrastructure, and it does not mean to immunization. Preventive healthcare is more of the programs, how to keep our country or the Filipinos healthy and not really entering the hospitals.
What did you suggest to them? What was your proposal on how to do that?
Well, for this year, we are promoting a 1 billion hope sana budget for the health promotions, but I guess it was not approved, okay? But we were pushing for health safety, preventing people from entering the hospitals by promoting healthy lifestyle, healthy eating, physical exercise, and public safety for the Filipino
so
people.
more on information campaigns.
Information dissemination and massive education campaign, because of course we on nutrition-based kind of healthcare is what we want.
How has it been so far? Do you think that most Filipinos already have grasped what you're trying to share?
It's going there. It's an endeavor made by different individuals, Filipinos. They are more conscious of what they're putting inside their body. But of course, we still have to promote more. And I believe that DOH should be the first one to do that in cooperation with the other with the other agencies. Like, for example, Department of Agriculture, what types of food to plant.
Yes.
And then, of course, we also advocate for a GMO-free Philippines, of course. And then we also advocate more parks for exercise, for biking, etc. So that's what we really promote and advocate for. And then what else? We also wanted more nutrition-based treatments for those with already illnesses, because even the Western father, the Hippocrates, said that we should use food as our medicines.
Yes.
So that's what we want a DOH to see.
Considering the high cost of medicines nowadays, the treatments that you'll get, they're very expensive. But we can actually see now a trend into going back to traditional medicine, to alternative medicine.
Yes, we call it more of the traditional medicines, because they've been there for thousands of years already.
We just forgot about it for a while.
The DOH even approved 10 herbal plants already for us, like lagundi, sambong, ampalaya.
So the government recognizes its importance.
Yes, it has the importance, and we just have to teach our people how to use them, and it's very cheap. They don't have to go to the hospital to treat their illnesses. Of course, I am not really advocating self-medication, but number one in healthcare is to know your body. As an individual, you have to know your body. You have to listen to it, the body signals. That's the first thing that you have to do in terms of your healthcare, to take control and empower yourself about your healthcare.
But that also involves that you need to be self-aware as well on what these signals are.
Yes,
like rashes are a sign of your body expelling some things. But
Yes.
these things really do require more education.
Yes, actually, health is really an endeavor, an effort. It's a change in the lifestyle. So it's not just weight loss. It's not just reducing our body weight, but also to research, plan ahead. It's reducing what we are most convenient of. Because we are into instant nowadays, so we have to shed off that instant in our system and in our lifestyle.
Okay, let's look into the 2013 health trends.
Yeah.
I mean, let's start first with diets.
Yes.
I mean, there seems to be more people are into juicing nowadays.
Yes.
Is that one of the trends that you saw in 2013?
Well, that's one thing that we saw this year, this 2013. Many have been going into juicing to detoxify, to also maintain their weights. Different kinds of green juices
Yes.
that we see. So that's one trend. And then the other is that many are into sports like triathlons, swimming, biking,
Cycling, like Professor De Vera.
Yes, that's what they do. Running, and of course we cannot forget the Zumba thing. It's so in right these days, and it's a good cardio and fitness regimen for many or most of us who are into dancing, and of course yoga. There
are those that they mix yoga with Pilates
Yes.
and ballet. I think that's part 3.
One thing that my instructor in ballet dancing taught us is the goddess workout.
The goddess workout.
Yes, there is a goddess
I think I
workout.
like
It's a
that.
combination of Zumba, belly dance, and Pilates. It's a cardio and strengthening
So the trend now
exercise.
really is, it seems to be mixing different
Mixing.
types of exercises.
Yes.
Are we moving away from the heavy exercise
Well,
equipment?
even my instructor in the gym does not really promote machine, especially for women. Okay, not unless you're into the bodybuilding arena.
Yeah.
Because they more on the floor exercises, the usual and traditional way of exercises, crunches, sit-ups. Those are the most effective exercises. So that's what we do in the gym. Even in the gym, they have more of these exercises rather than most men go for gym equipment, but not the women.
Not the
and
women.
then I am more into also healthy eating versus dieting.
Yeah, there's a proliferation
Yes.
of organic stores or stores that
Yes.
offer organic,
Yes.
natural, and there's a new term that I'm hearing, biodynamic. What's the difference of these?
Well, let me go first to the natural and versus the organic. There is a difference there. Well, organic really is mainly those that plant using organic fertilizers, meaning those the natural wastes from the kitchen, from your house.
Sealy
Yes,
for
yes, and
antibacterial
that's the use. And the natural means not using any type of fertilizer, any synthetic or chemical-based fertilizer, but
Okay.
not necessarily organic fertilizers, just the old traditional way of farming without the pesticides. But the organic really go one step ahead, meaning they make their own fertilizers.
Okay.
So when you eat, well, both are good actually. So many people do eat organic. That's healthy eating. You choose organic and safe food versus what you get what you get in the supermarkets.
Do you see these as the possible trends for next year?
Yes, because many healthy dining restaurants are opening. Many health shops too are opening.
One-stop shops that offer all
One-stop
these
shops.
organic products.
Yes, there are a couple now, but of course we wanted all these things to be accessed by many. That's what we are here, the advocacy that I am into are here for accessibility and availability, not only for us who can buy it, but also for those in the communities, especially now that we are talking about the resiliency of communities. So planting organic and caring for the environment is the way to go. Not simply as dieting,
Yes.
weight loss reduction, more beyond those terms.
Apart from the, what
Yeah.
is your hope for 2014 in terms of the Filipinos' health and fitness status?
Well, if the government is really concerned about the healthcare of the Filipinos, well, one thing that they are doing right now is trying to cover everyone under PhilHealth. If that's the way to go, that's our way of health financing, then we go for it. Cover everybody. Don't ask for a lot of requirements, especially the poor people, Filipino people. They don't have any documentation. Cover them, number one. And number two, let's try to veer away from only infrastructure-based and immunization type of preventive healthcare, but let's go into really preventing Filipinos from getting sick.
All right.
By promoting, healthy lifestyle, healthy eating also.
Okay, thank you
Yes.
so much, Jofty Villana. She's into health and fitness, and thank you so much for
Thank you
sharing
very much,
your
Ellen.
ideas
Thank
with
you.
us.
Thank you.